Thank you very much, the SRPC.
Bula is part of the Kashu region in Guinea-Bissau, which is just 30-kilometer drive from the city. Like other areas in the country, Bula is supported by the Ecowas peacekeeping force through its medical corps. This facility supports nearby towns and villages to access medical care. The funds to refurbish the clinic were raised by these women drawn from nearly all the West African countries that make up Ecowas. They chose the name Amazons after the Dahomey Empire, which had female warriors. Like those in that empire, these women are changing the narrative in a world that is male-dominated. ECOWAS resident representative in Guinea-Bissau, Professor Hamidou Boli, was amazed at the work done by the female employees of ECOWAS, who from their meager resources raised funds to support those in need.
I think that the country has a weak medical services because of the other facility around medical, that is road and infrastructure. So they are very weak on that. That's why the health system also is suffering the fact that it's difficult for population to join the hospitals. And secondly, the equipment also are very weak and they are very in low position. So what ECOWAS is doing, we are trying now with our military forces here to do civil and military cooperation activity. And then we delocalize our military hospital to the region for 1 week, and we try to help them to solve their systems.
The vice president of ECOWAS Amazons, Maria Massi, said they drew their inspiration from the women of the empire, now present-day Benin, and they wish to emulate their good examples. She catalogued the successes that the Amazons women have registered, which range from promoting the rights of women and the establishment of ECOWAS Women's Forum.
We are the Amazons. Why the Amazon? As you all know, the Amazons are warriors from the Republic of Benin, from the Empire of Dahomey, which is now the Republic of Benin. They were warriors. Around the 16th centuries. Courageous, valiant women.
Guinea-Bissau has one of the weakest health systems in West Africa, and this was confirmed by the Minister of Health, Dr. Asmieu. The ECOWAS peacekeeping force in Guinea-Bissau is not only providing security to key installations in the country, but also engages in civil-military relations, like helping communities access healthcare. In Bula, the presence of the force is felt not only by its military posture, but what it does to the community people who see them as their source of support and hope.
Since our arrival here, we have been engaged in a lot of activities. We have been conducting patrols, we have static deployments, we conduct escorts of various types, presidential escorts, logistics escorts, we do all of that. And most importantly, we are involved in civil-military cooperation activities, medical outreaches, donation of medicines and medical expendables to various communities and hospitals, conducting medical outreaches, donation of medical, I've said medical equipment, donation of educational materials to schools, among several other activities.
Brigadier General Al-Hassan Muhammad Grima is the first commander of the mission. His presence on this occasion was not only to bolster the courage of Amazon's women, but to also assure the Bula community of ECOWAS standby force support and security assurance. Brigadier General Grima commands a force that comprises men from Nigeria, Ghana, Cote d'Ivoire and Senegal. This force was assembled after an attempted coup on President Embalo. Guinea-Bissau continues to be a fragile state. The force commander assured the populace that the force will stand by them and defend the government.
We have done a lot. I think a lot more needs to be done. But the National and Defense Security Forces of Guinea-Bissau, we do all our activities in close collaboration and coordination with them. So our presence here It's good. We are working together. If and when we have to leave, I'm sure necessary arrangements will be made for them to continue what we are already doing together. So I don't think there will be much problem.
This small West African state of little over 2 million people has had its own share of political instability and turmoil that has derailed its progress among its peers. But Guinea-Bissau is now making progress in terms of rebuilding its governance institutions. It has a youthful population like many West African countries, but unemployment remains a challenge.